monuments entail,
being
but
released
more
after being held captive by Hamas.
COVID-19 is no longer a public health emergency of international
caught the
concern.
attention of the
This is
World Health
after 3
Organization.
years with more
It's
than
not clear when the outbreak began or what's driving the infections.
The World Health Organization, a specialized UN agency, is a key player in international public health. Yet, its role remains unclear to many. This video aims to pull back the curtain, shedding light on the purpose, function, and impact of the World Health Organization.
The thing that distracted me.
A terror organization.
A week in the a new vaccine research.
The World Health Organization
And primary school in Rafah.
People not to become intelligence agencies.
we have no future but a shared future.
I give my closing speech. I would like to take a moment to recognize
The WHO was established in 1948 as a specialized agency of the United Nations, with its headquarters in Switzerland. The impetus for its formation emerged after the devastation of World War II, recognizing the need for an international body to oversee health and coordinate responses to health-related issues. The WHO Constitution came into force in April 1948, making it responsible for the international public health. The organization's early focus was primarily on communicable diseases, healthcare systems, and developing basic health infrastructure in various countries.
Thank you, Madam, for
it initiated various global health campaigns. Over the years, its mandate expanded to address broader health issues such as non-communicable diseases, mental health, maternal and child health, and responding to humanitarian crises and health emergencies.
Including consideration of the executive board's...
One of the significant moments in the organization's history was the Alma-Ata Declaration in 1978, emphasizing the importance of primary healthcare. This declaration shifted the focus towards a more comprehensive approach to health, highlighting the significance of prevention and community-based healthcare services. The organization faced numerous challenges and controversies, including criticism over its handling of global healthcare crises and emergency responses. In the early 21st century, it grappled with issues like the SARS outbreak and H1N1 pandemic and the response to the Ebola crisis in West Africa. Now, the organization remains a pivotal player in global health, continuing working to improve healthcare worldwide.
What will WHO be without its structure? Hi, my name is Firdaus. The World Health Organization, or WHO, functions to enhance global public health. The organization has 194 member states, and the process of membership is outlined in Chapter 3, equivalent to memberships and associate membership, specifically in Article 3 and Article 4. Additionally, details about the entry into a force of the Constitution can be found under Chapter 19, and this should be read in conjunction with Article 78 and 79 of the WHO Constitution. These provisions collectively define the composition of WHO memberships and the procedures for entry into the organization.
As I see no objection, it is
Furthermore,
decided.
under Article 3 of the World Health Organization Constitution implies that membership is open to all states. However, under Article 4 specifies that membership is granted to those who are members of United Nations with a process involving explicit actions such as signing or other clearly understood methods. This acceptance into membership is in line with Article 79, which outlines the prerequisites for becoming a member state. Additionally, Article 5 clarifies that states that join of the United Nations before or as of 1946 remain members of United Nations and may become members of WHO through the established methods.
and the European Union. The European Union delegation attends the...
The question remains is whether states outside the United Nations or the one who does not involve or to be part the members of United Nations can join WHO or not. This is provided under Article 78 of the Constitution. Address this by allowing any state mentioned in Article 6 to be a member, subject to Health Assembly approval by a simple majority vote. The emphasis states in a provision rather than members clarify its applicability to states not in the United Nations.
52nd session.
The World Health Organization organized its member states into 6 geographical regions, each with its own regional office. Malaysia, situated in Western Pacific region, is grouped with 36 other member states under the Regional Office for the Western Pacific. Additionally, there are 5 others, namely Africa with 16 member states, the Americas with 55 member states, the Eastern Mediterranean with 23 member states, Europe with 52, and Southeast Asia with 11 member states. This regional office, equivalent in function to WHO itself, serves to address health issues and promote well-being within their specific geographic areas, fostering collaboration and tailored approach to the regional health challenge.
Outcomes. To fully leverage the power of communication.
This can be seen where WHO Regional Committee for Western Pacific leaders endorsed Communication for Health, or C4H, on 20th October 2023. It is to ensure effective communication, innovation in health impact, and workforce transformation. Each regional office has a chief executive overseeing state conduct in line with the WHO principles, preventing any negative actions by the states.
Audience and people-centered, collaborative, drawing on the skills and efforts of a broad range of experts, partners, and stakeholders.
On the other hand, there is also an office known as a country office, whereby it is a collaboration of all professors and scientists from all nations, and together with the United Nations agencies, non-governmental organizations, foundations, the private sector, and affected community to set a benchmark to enhance crucial healthcare service for treatments, preventions, and care.
Since the inauguration, WHO's response to major global crises were managed from here, such as H1N1 pandemic, the Ebola crisis in Africa, and COVID-19.
There are 22 functions of the WHO listed out in Article 2 of its constitution. The organization encompasses a wide array of responsibilities, from serving as the guiding force and central coordination in the international health efforts to collaborating with various entities to support and enhance global health services. The functions include providing technical assistance, aid during emergencies, and supporting health services for specific groups or territories. Moreover, it extends to a disease eradication, accident prevention, and the promotion of overall living conditions. It emphasizes the importance of cooperation, research, and education in the health domain while advocating for improved standard of healthcare practice and studying social techniques impacting public health. Additionally, the organization aims to inform, guide, and foster the public opinion on health matters and establish international standards for health-related products.
Emergencies. Make decisions on important public health issues. This is also the room where WHO all-staff meetings take place.
Communication of public health information between WHO and states bonding.
Power is the flower of one organization. A wise word from Philip Randolph. Power, as a layman understanding, refers to an individual's or group's ability within an organization to influence and drive actions that align with the organization's goals. In the context of the World Health Organization, its objective, outlined in Chapter 1, equivalent to the objective, specifically under Article 1 of its constitutions, suggests that it serves as a platform for delegates from all states to collaborate and achieve specific goals. These goals are detailed in Chapter 2, equivalent to functions under Article 2 of the Constitution, which lists 22 matters that the organization aims to accomplish. The World Health Organization power is exercised through 2 main bodies. The first one is the World Health Assembly, and the second one is the Executive Board. Starting with the World Health Assembly, it can be seen as a global leaders conference where agendas are discussed and decisions made that all states are expected to comply with. This assembly held annually in May in Geneva, as specific in Article 13 of the Constitution, holds significant influence.
Body of the World Health Organization, and its main function is to determine the policies of WHO, appoint the Director General for a 5-year term.
Decisions made in this assembly are not just recommendations. They can be binding for all member states. For example, under Article 21 of the Constitution empowers the assemblies to adopt regulations. Once accepted by the Health Assembly, this regulation, according to Article 22, can be enforced on all members following proper notice. This highlights the organization's power to universally bind states through the regulation adopted during the annual assembly. The enforcement of regulation adopted by World Health Assembly does not occur immediately. The Assembly allows states sufficient time to adopt this regulation in accordance with their domestic legislation and regulation. An example of this process can be seen in the 75th World Health Assembly held on 22 to 28 May 2022, specifically on the Provisional Agenda 16.2. This agenda aimed to enhance the World Health Organization's readiness and capability to respond to health emergencies by amending the International Health Regulation 2005 in alignment with the regulation of the United States of America. The proposed amendment was implemented after consideration by the Assembly. In response to the amendment, as outlined in paragraph 46 of the report on the International Health Regulation 2005, member states, the Secretariat, and other partners collaborate during the COVID-19 response to identify priority actions for strengthening health emergencies preparedness and response capacities. The collaborative efforts involve constructing national health security systems linked to the resilient health systems through various platforms, including regional committee meetings. The functions of the World Health Assembly are elaborated in Article 18 of the Constitution, encompassing 22 specific functions. However, it is important to note that the World Health Assembly itself does not have direct effect of binding all states to its policies or regulations. This binding effect is conferred by the Executive Board, or the second main bodies. The Executive Board plays a crucial role in translating the decisions and policies discussed in the World Health Assembly into practical implementation.
From Thailand and a rapporteur.
While the Assembly sets the agenda and discusses various health-related matters, the Executive Board ensures that these decisions are effectively carried out. The Executive Board actions contribute to the enforcement and impact of the policies and regulation adopted by the World Health Assembly, thereby influencing the function of the organizations on a global scale.
To the more effective and efficient.
You have the floor.
Now, the Executive Board of the World Health Organization consists of 34 individuals with technical qualifications in the field of health. Each member is chosen by a member state to represent them in the World Health Assemblies, as these delegates serve 3-year terms as a government representative, not as individuals. The functions of the Executive Board are outlined in Article 28 of the Constitution, and its primary role is to give effect to the decisions and policies of World Health Assembly. In essence, the Executive Board plays a crucial role in translating the Assembly's decisions into actions and ensuring the effective implementation of health-related policies and initiatives on a global scale. The World Health Assembly and Executive Board are two separate bodies within the World Health Organization, each playing a distinct role in achieving the organization's goal. In terms of effectiveness, the World Health Assembly holds a superior position. This assembly serves as a platform for combining ideas, policies, regulations, and other methods to create comprehensive international regulations and mechanisms that are binding for all members of the organizations. The Executive Board, outlined in Article 29 of the Constitution, operate on behalf of the World Health Assembly and exercise powers delegated to it by the Assembly. While the Executive Board possesses certain powers and discretion, it operates within the framework set by the Assembly. The Board's function as specific in Article 29 include performing tasks entrusted to it by the Health Assembly, advising the Assembly on referred questions and methods assigned by conventions or agreements and regulations, submitting advice or proposal to the Assembly, and preparing the agenda for the Assembly meetings. In essence, while the Executive Board plays a significant role in implementing and advising on the decision of World Health Assembly, the Assembly holds a higher position in terms of formulating and deciding upon the overarching policies and regulations that govern the organization.
Now, we proceed to problems and challenges faced by the organization. Firstly is in regards to the healthcare delivery in areas of conflict and crisis that involves providing essential medical services in regions affected by war, disasters, or humanitarian emergencies. It ensures access to medical care and supplies despite damages or disrupted healthcare system. The organization is actively working to ensure crucial healthcare and humanitarian aids in these regions. This was evident when the WHO Director General collaborated with the Egyptian President to transport vital resources from WHO to Gaza via the Rafah crossing. This was urgently needed as the Gaza's hospital were low on supplies and fuel, relying on only backup generators. Secondly, elevating health in climate crisis. The aim is to raise awareness, implement policies, and develop strategies that protect and promote public health amidst the changing climate conditions. The organization collaborates with governments and industries to implement policies. For this instance, they aim at reducing air pollution in urban areas as a part of elevating health in the climate crisis. Together, they enforce stricter emissions regulation and advocate for cleaner energy sources to combat the health risks linked to poor air qualities. Another problem faced is in regards to unsafe products that typically refers to items or substances that pose risk to human health either due to their quality, composition, or usage. For instance, nearly 1/3 of the global disease burden is due to inadequate food, unsafe diets, and food insecurities as per the organization. While hunger remains a concern, there's a rise in weight-related diseases due to high-fat and high-sugar diets. Tobacco and e-cigarettes use are also increasing, posing additional health risks. To address these challenges, the organization aims to collaborate with nations to create evidence-based public policies, investment, and reforms within food system for healthier diets. They also seek to strengthen tobacco control policies by building political commitment and implementation capacity.
Matter. Timely, reliable, comparable, disaggregated, and actionable data are critical for measuring and tracking population health outcomes.
I'm your Dina Patricia, and I'll be leading you on the criticisms and reforms faced by the WHO. As the face of global health, the WHO has been subject to numerous criticism.
Their determinants and health inequality
Now,
vary.
one of the critiques directed at the organization is its coordination of responses and attempts to manage diplomacy with member states. As we all know, the WHO is at the forefront of coordinating responses towards health crisis. However, seeing that the WHO's policies are non-binding in nature, the success of its policies rely heavily on the cooperation and political will of fellow member states. This makes it of utmost importance for the WHO to maintain diplomatic relations. However, in its attempts to maintain diplomatic relations, the WHO has been severely criticized, especially during the handling of the COVID-19 outbreak. The criticism centered on 2 points. Firstly, the WHO's inaction after the initial COVID outbreak in China, and secondly, the WHO's treatment of Taiwan during the pandemic. Now let's look into the first point. Critics, especially coming from Western states, such as the US, have criticized the WHO's initial reaction to the COVID-19 pandemic, beginning with the downplayed information given by China. In December 2019, the Chinese authorities reported cases of pneumonia-like illness in Wuhan. The WHO, in response to this, praised China for its transparency and efforts to contain the virus. The situation then escalated, and on the 30th of January 2020, the WHO declared the outbreak a public health emergency of international concern. This declaration was criticized for being a little too late, as an earlier declaration could have prompted a swifter response to the situation. Critics have also disputed the information relayed by China regarding the initial outbreak in Wuhan, citing reports of local authorities suppressing news on the outbreak. Next, we'll look into the WHO's treatment of Taiwan during the COVID-19 pandemic, which also invited quite a fair share of criticism. By late December 2019, the Taiwan government had already expressed concerns to the WHO regarding the Wuhan virus's potential for human-to-human transmission. WHO largely ignored Taiwan's warnings, in spite of the state's geographical proximity to China. Instead, the WHO endorsed China's denial of human-to-human transmission, until January 21, when China confirmed it. You might be wondering, why did the WHO ignore Taiwan? Well, Taiwan is an observer state and has no official seat in the WHO. Aside from that, the WHO was probably trying to maintain good rapport with member state China. Based on what's been said, if you're thinking along the lines of the WHO being subservient to its member states, well, you're not far off. We've emphasized the point that maintaining diplomatic relations is crucial to ensure enforcement of WHO policies. But it's also important to note that the WHO is highly dependent on their member states for funds. Before we get into the implications of this, let's scale back and break down the WHO's funding. So, the WHO gets its funding from two main sources: assessed and voluntary contributions, both paid by member states. So, member states contribute up to 60% of the WHO's funds, which leads us to our main point. The WHO's financial dependency on member states have more or less crippled the organization. Now, what we mean by this is that the WHO is not able to independently set and implement its own program priorities and is exercising caution in criticizing its member states as it is reliant upon their goodwill. Moreover, any political conflict could easily hinder any global health coordination. Just look at what happened between the WHO and Taiwan during COVID-19.
Almost 1/3 of the world's population is fully vaccinated against COVID-19. But those numbers mask a horrifying inequity.
I am Ashkar Azali, and now we are moving to see the critical evaluation on the effectiveness of WHO for its strengths and weaknesses. We will primarily focus from three perspectives, which are global health leadership, emergency responses, and technical assistance and its capacity building. First is global health leadership. So WHO has shown strong leadership in setting global health standards and responding to major crises, as seen in its effective coordination during the COVID-19 pandemic. Additional instance, the success like eradicating smallpox and ongoing efforts against disease like polio highlights its ability to tackle significant health challenges globally. The organization is a key advocate for public health, addressing diverse health issues and influencing international health policies. As for the weaknesses, the WHO faced global health leadership challenge due to the member states' dependence, financial constraints, bureaucratic inefficiencies, and so on. The WHO reliance on member states for funding and cooperation, along with the potential political influence, may compromise its independence and impartiality. The bureaucracy also can slow down the WHO emergency response, such as hindering the organization's ability to promptly implementing interventions, conduct research, and assist countries with the fragile health system. One example that highlights the weakness in WHO's global health leadership is the management of the Ebola outbreak in the West Africa. So we can see that WHO demonstrates significant strength in global health leadership, particularly in setting standards and responding to crises. However, the weakness needs urgent attention for the organization to enhance its effectiveness by diversifying funding sources, enhancing organizational efficiency, and strengthening resource mobilization. Therefore, the rate for WHO global health leadership is moderate to satisfactory. The second one is emergency response. So WHO plays a crucial role in emergency response, providing their technical expertise and coordinating international aid, which can be seen in the 2009 H1N1 influenza pandemic. They illustrate their strength in early detection, risk assessment, global coordination, and collaborative response planning during the public health emergency. For weakness, WHO faced criticism for delayed response and inefficiencies in crises like Ebola and Zika outbreak, and it was due to several factors such as internal coordination issues, weakened healthcare system, slow case recognition, rapid spread, identification difficulties, reluctance to declare a global emergency, and limited resource. These issues raise concerns about the organization leadership's governance and adaptability in addressing global health challenge. So, while WHO illustrates the good example in emergency response, the highlighted weaknesses raise concerns about its adaptability and leadership in emergency situation. Therefore, the rate for WHO emergency response would be moderate. Last but not least is technical assistance and capacity building. WHO provides technical assistance such as shared expertise, resources, and improved disease surveillance. They focus on the capacity building by developing a country-independent health management, local institution, and healthcare practice. For instance, during COVID-19, WHO rapidly produced and distributed technical guidance on COVID-19 management, protocol, and vaccine distribution. Hence, it can be seen that WHO guidance empowers nations to autonomously address health challenges and create a resilient network for worldwide concerns. Moving on to the weakness, tailoring assistance to the varied context of different countries can be very challenging. A one-size-fits-all approach may not be suitable, and the organization may struggle to address the unique needs and challenge of each nation. The WHO lacks the authority to enforce its recommendations, and the success capacity building efforts rely heavily on the voluntary cooperations of the member states. This can limit the organization's ability to ensure widespread of the implementation. And this can be seen in the case of Ebola outbreak in the West Africa that I mentioned before, which contradict with how WHO handling with the COVID-19 issue. So we can see that WHO exhibits excellent strengths in providing technical assistance and capacity building, especially in its rapid and tailored response. Henceforth, the rate is moderate to effective. However, the weakness in tailoring assistance and the lack of enforcement authority will pose limitations.
A year ago this week, the World Health...
How can we fix these issues? This is our suggestion for the reform of the World Health Organization. Now, the organization's reluctance to criticize member states, as well as their reliance on them, can be pinned down to one crucial point: financial dependency. Thus, there is a need to decrease the WHO's financial dependency on member states. This can be done by increasing the share of assessed contributions to the WHO. Assessed contributions provide more natural limits to unilateral influence than voluntary funding. And by lessening the influence of the states, the WHO would be able to increase its autonomy as an organization. That wraps up today's documentary on the WHO. We hope you understood a thing or two on the ins and outs of the World Health Organization. Thank you.